Hey everyone, it's Laura and welcome back to another video. This video is going to be all about my top clinic tips. Since starting third year, I've kind of kept a list of what I found helpful in clinic, and now I want to share it with you guys so that you don't have to learn from experience and you can just learn from watching this video so you don't have to struggle like I did. These tips aren't necessarily in order from like most important to least important. I just wrote them down in my notes section on my phone and I'm just gonna go through them. I think they're kind of in chronological order in terms of how the appointment would go. But yeah, I just wanted to let you know that these aren't ranked by importance or anything like that. I'm also gonna try to keep this video short and sweet, so if you want more clinic tips like these, then please let me know in the comments so I can make another video like this. My first tip is to go to clinic at least 10 minutes early. This just helps you set up, it helps you kind of calm your nerves and get everything ready before your patient arrives. Our lectures in the morning usually end between 9:10 and 9:20 a.m. Then our first appointment is at 9:30 a.m. Usually right after lecture, we are headed straight to clinic, grabbing everything that we need and setting up our operatories. Next tip is to set up and stay organized during the appointment. Our assistants set up our cassettes for us. Anything else that we need from the dispensary, we go and set that up. I like to set up my operatories, so like have all my handpieces and burs on the handpiece tray and then on my little assistant table, I guess you could say. That's where I keep my open cassette. Also, it's really nice for me to go in early to clinic because I'm left-handed and most, if not all, of the operatories at our school are set up for right-handed students. And so I just have to go in early and kind of set up the handpiece so that it comes onto the left side instead of the right side of the patient. So it only takes like a couple seconds, but I just like to have that set up beforehand so my patient doesn't have to like watch me do all that stuff and change the operatory. I feel like it's a little bit difficult to stay organized if it's a really stressful appointment, but trying your best to stay organized and knowing where things are very important, especially for when you're working with assistants, because say you have a 12 blade or a 15 blade somewhere on the table. You want to make sure that it's covered and it's organized so that your assistant can see it, and also mention it to your assistant so that they are aware of the sharps. Another tip is to pre-write your SOAP notes. I don't know how other dental schools teach their students about how to write their notes, but at UW we use the SOAP note template, which is subjective, objective, assessment, and planned/progress. I feel like a lot of students have templates that get passed down from upperclassmen. I actually think the faculty at our school prefer that we have these templates just because our notes are a little bit more consistent and they know what to look for. Even with those very generic templates that we're given for each patient the day before, I like to copy and paste that into my own personal scratch pad in Axiom and just kind of fill in the specific things for the patient that I'm seeing. For example, I'll just fill in like, I'll just use myself as the patient. So I'll say 25-year-old female patient presents for blah, 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 and I'll leave that blank so I can fill it in when the appointment time comes. Don't put your pre-written SOAP notes into your patient's chart until they actually show up to the appointment, because you don't want to end up in a situation where you entered notes but then that patient never showed up, and what if you entered the note on the wrong day? So you can get into a sticky situation if you pre-enter those notes, but if you pre-write them and keep them somewhere for just you to see and easy access to copy and paste into your patient's note when they actually show up, and that is what I suggest doing. The nice thing about pre-writing SOAP notes for me is that I like to pre-write step-by-step the procedure that I'm going to be doing on this patient. If I forget for some reason what the next step is, I'll just take a look at my pre-written SOAP note and I'll be like, oh, okay, I already did this, so the next step is this, and I'll just have it written out. And it's nice because you want to mention that in your SOAP note anyways. You basically have the protocol of what you're going to be doing written down so that you can just refer to that. And then of course the pre-written SOAP notes need to be adjusted for the patient's actual chief complaint that day. You're going to enter vitals, you're going to enter what you actually did, because the procedure that you may have outlined may not be what you actually did, and so you always want to cross-check those. Next tip is to write everything down that you need from the dispensary on a sheet of paper. For example, light cures, blood pressure cuffs, Palodent rings, rubber dam clamps, composite shade guides, matrix systems. Those are all at the dispensary. They're not in our operatories, and so it's efficient when you write everything down on paper that you'll need, so that when you go to the dispensary, you only have to make one trip and not go back and forth time management is so important during appointments. Basically, I just have like these little benchmarks of when I want to be done. Say by 10 o'clock, I should already have my patient numb. I should have the rubber dam on or isovac if I'm using an isovac that day. I should have isolation done and should be ready to go for my prep. And then say by 10:30, I like to be done with my prep. Everything's clean, ready to go from 10:30 to 11. Say I'm filling and finishing, and I like to keep those kind of time slots in my head just so that I can be aware of where I'm at in the procedure. This also brings me to my next point, which is make good use of free time. With the limited amount of free time that you have during a procedure, you still want to make use of it. For example, for me, when I'm applying topical, that's when I get my signature for anesthetic, and then I go run to the dispensary and grab my carpules of anesthetic, come back, and then I'll punch my rubber dam during the time that I'm waiting for them to get numb. So heads up, in clinic, you're gonna be waiting a long time for faculty sometimes. And in these cases, it's best to make use of that time that you have. Basically just work on your soap note as much as you can while you're waiting for your faculty to come check your patient. Next tip is really important. Cover your burs with a cup or take them off of the handpiece when you're not using them. This is important because you don't want an exposure. Say the burr that you were using to prep the patient's tooth with, you have that burr, and then you seat your handpiece down. And then say you're like, oh, you're checking around the patient, seeing how the prep looks, and then, oh my God, your burr's right here, and you hit your head. That burr touched the patient's mouth, and then say you're bleeding now, you have an exposure, and then you need to go report that and deal with the whole fiasco. So you want to avoid this as best as you can. Sometimes I'll just have like a cup, like a plastic cup, and I'll just put it over the burr if I don't want to take it out. But most of the time I prefer to just, after I'm done using a burr, I like to take it out of the handpiece and put it back in the burr block, just so I don't have any sharps around. Make use of your dental assistants. I think sometimes we get so used to trying to do things on our own that we don't realize that these dental assistants are here to help us, and they can make our lives so much easier. But you have to understand that they're there to help everyone. They can't just be in your operatory the entire appointment. So you gotta learn how to use them, but don't abuse them, you know what I'm saying? So those are my top clinic tips for now. If you have any other clinic tips that you'd love to share, then please leave comments below so that we can share the knowledge. If you liked this video, make sure to subscribe to my channel for more and give this video a thumbs up so I know you enjoyed this content. But that's it for now. I'll see you guys in the next video. Bye.